Welcome back to Hey Baby and Beyond. I'm Lauren, an antenatal and postnatal teacher here in the UK. I'm here today to talk to you about antenatal expressing of colostrum and hand expressing. So before we carry on, don't forget to subscribe to the channel because there's new videos daily. Like this video and do comment any questions that you've got below. So let's talk about antenatal expressing of colostrum. Now what colostrum is it's the baby's first milk they get. So it's often known as liquid gold. It's really important because it's got lots of antibodies that can really be useful for your baby. So some people choose just to use colostrum and not go on to breastfeed. Other people do both. Some people do neither. And again, it is your choice. So antenatal expressing of colostrum is quite useful because in the first few days after your baby's born, you might find that your baby isn't as quick to feed as you'd expect, or if they went to the special care baby unit or there's any other issues, then you can use this expressed colostrum to feed your baby. So it's also a good way of starting to understand the way your breasts work and produce milk, because it's something that we've probably not done before, so it's all new. So you're gaining confidence at the same time. So what you need to do is you need to make sure you've got clean hands, and you need to make sure that it's at a time that you're relaxed, calm and not feeling stressed. The more you stress about doing this, the harder you might find it to actually get anything. Remember that when you're expressing colostrum antenatally, you may only see the tiniest of little amount, and that's okay. This is not going to be a telltale of how your breastfeeding journey will go. It's just how it is. So making sure you've got nice clean hands, you're comfortable, you're laid back, you're nice and warm. So some people choose to use a warm compress on the breast tissue, which it's up to you. Some people find that just by massaging the breast tissue, they can kind of start to do the expressing. So when we're talking about massaging the breast tissue, what we're doing is we're talking about massaging the area around the areola. So it might be a case of start by warming it up. You can then start to massage forward because the milk is going to come out of the nipple. So we need to massage the area and start to bring everything warmed up so that we can start to get the expressing going. So you start to stimulate your breast, which is going to release oxytocin, which is going to be what produces the colostrum. So once you've done some massage and you've made sure that everything's warm and you're feeling comfortable, you can then make a C shape with your fingers. So making a C shape, placing it still around the areola but near to the breast tissue, and you can start to work your way round a little bit like a clock. So as you're working around, make sure you're bringing the skin forward as well, but not so that it's uncomfortable. We don't want you to be in pain doing this. And then you can start to very slowly squeeze the C shape and then retract it. So squeeze it and retract, squeeze it and retract. Now you're going to take a long time to get used to this. Some people longer than others. Some people will do it straight away. And the idea is by using a colostrum syringe or a very small syringe which has been sterilised, you're going to be able to take the very end off where the colostrum is. So the colostrum will produce around the nipple, and what you're going to do is you're basically going to suck up the colostrum as you see it. Now the very first few days you do it, you might not even get enough colostrum to be able to suck up. It's quite hard to do at first, but as you get used to it and become used to what part, by stimulating which part works for you, it will be different for everybody. So if you find that you're struggling to catch it on the syringe, you can use a teaspoon and then suck it up off the teaspoon. But you're not going to see lots of colostrum. You're only going to see a very small amount. The good thing about doing this in general is that you're getting used to how your breasts work. You're getting used to the motion for hand expressing, which can be really useful once your baby arrives. So hand expression is a really good technique to have. When we have expressed our milk, we're only going to do a couple of expressing sessions a day at first, and you're going to start this from around 36 to 37 weeks. Now you might just do 2 times a day, or you might kind of do it a couple more times a day and build it up. You can catch it on the same syringe, and this syringe can then be stored in the fridge until you finish with that day's worth of expressing. When you've done that and you finish with that syringe, place it back into its sterile pocket that you would have slid it out of, and then basically you will seal that back up. you would write on there when you did it and what time you're freezing it at, and you can then get yourself a box or something similar or a bag, and you can then place that into there, package it up, and then put that into your freezer, and that can then be stored until you need it postnatally. So you can take it to the hospital with you if you want to, or you can just use it when you get home. It's there just in case. So it can be really useful, but don't put that pressure on yourself. If you're not seeing it, it isn't going to mean that your breastfeeding is not going to be successful. So I hope you found that video useful. Please do give it a like. Please do comment if this is something that you did, or if you want some more tips, and make sure you do subscribe for more videos.